Hello, and how are you? Welcome to my session on Pillars of Palliative Care. My name is Winnie Berawa. If you're new here, this is a channel that focuses on lectures, notes, and expert interviews on on healthcare. Remember to subscribe and click on the notification button so that you can be notified when we post our next class. So we've been doing topics on palliative care. If not watched yet, you can refer back to the various topics that you've handled on the same. So these are the main pillars that are part of palliative care, and they're supposed to promote the holistic aspect of care when you're taking care of a terminally ill patient. They include physical, emotional, mental, financial, spiritual, and the social pillars. They are all taken care of differently, but the main agenda is to ensure that the critically ill patient or the patient with a terminal illness has been taken care of adequately, meeting each and every aspect of their life. So let's see what each of these entails. So the pillars of palliative care, these are issues addressed using multidisciplinary approach. It ensures that each and needed stakeholder or healthcare provider has been consulted and brought to be part of the team to ensure that at least the patient is taken care of in all rounds. So the issues handled under the pillars will include most of the time will be the spiritual or spirituality of a person. We'll have the emotional and coping mechanisms. There'll be physical and also practical well-being. So this is going now to form the holistic components that are going to promote the well-being of our patients as we improve the quality of care in their last days of life. So as you look at this continuum here of how they're related, is that a person is composed of all these the physical, the spiritual, social, emotional beings, and these aspects are what composes of the well-being of a person, and it will now fully promote the health status of this person. So based on this model and the pillars of care, it's being told that physical being or physical pillar will relieve more on pain and any presence of physical suffering that the patient could be experiencing. So to check more on symptoms, side effects of medication, or any physical manifestation that our client will be presenting at that particular time, and intervening respectively based on what is symptomatically to the patient. And on the emotional side, we will explore more on how emotions from our patient are being presented, looking at issues like anxiety and any possibility of depressive symptoms. And the spiritual pillar will look more into the beliefs that the patient has, looking into what defines as meaning and value to life. And so we need to appreciate that spirituality is very personal, and so we need to respect that as much as we would like to work with our patient. So this the main purpose is to bring peace and to allow our patient to connect with their spiritual nature and what their beliefs pertains to. So here you can allow the presence of a spiritual leader or a leader of any spiritual group to walk the journey with a patient and to counsel and guide our patient in a manner that will be meaningful to them. And lastly is on the social being. And on the social being focuses more on relationships and connections in the patient's life. This could be at personal levels, family, or even at the society level. So this is going to help the patient mend their relationship at this particular moment in their life, establish more networks, and give them more meaning and bond and love in regards to the people they consider important and closest to themselves at that time. So with these pillars in mind, it therefore brings us to an aspect of components of palliative care. And as we discuss these components, we bring out more how do we present the management of this patient looking at the pillars. So the first component is on the symptom management. And with symptom management, we are being explained to that you need to offer appropriate symptom management to maintain the dignity and self-esteem of our patient. additionally, by providing information on all the treatment options that are available and allowing our patient to make a choice from that. And while doing this, you can now administer the prescribed medications as required. So, appreciating some of the common symptoms of terminal ill patients include symptoms such as fatigue, there's aspects of nausea, symptoms could also be constipation, diarrheal symptoms, urinary incontinence, and in some instances, we can have ineffective breathing patterns presented by dyspnea and also shortness of breath. The other component is on psychosocial support, and we're being told that the most important psychosocial support that we can give to our patient is being physically present and verbally expressing empathy, giving positive regards and comments, and being available for practical support. For instance, if they need physical help or physical support in doing the activities of daily living, then this is a good sign of psychosocial support to our patient. Other ways is to encourage the patient to verbalize their fears and anxiety levels that they could be having. But more importantly, is give timely information to the patient about any clinical progress or prognosis. Now, psychosocial support mainly comes from the presence, the support, and the communication that we give to our patient because they need this a lot, and this is part of parcel of promoting their mental health stability. Third component is on social support. So this includes more on relationships and bonds. And so we are looking at involvement of family, involvement of friends, or even any clients or related networks that can be part of the social network of our clients. So we're told that family, friends, and the healthcare workers are the ones that are more valuable, and so they should be very available and supportive to the patient. And the other support we're talking about is the spiritual support. So, like you've repeatedly said, is that spiritual support or spirituality is a personal matter, and this means you have to learn to accept patient beliefs, but also helping them with issues surrounding any meaning and hope. So let's respect their religion, even if it interferes sometimes with the medical treatment, which is not a good thing sometimes, but yes, because it's a personal decision, it's a personal belief, we need to attach some respect to it. So allow us patient spiritual leaders to walk down with them, to offer the spiritual care and to offer the spiritual guidance at this moment. So these are part of the main components of palliative care, ranging from symptom management, social support, psychosocial support, and the spiritual support. So this brings together an element of supporting the pillars of palliative care, which we've mentioned that they will include physical, spiritual, emotional, and also the aspect of practical components. So thank you so much for being with me to the end. If you've not yet subscribed, kindly do so. And you can comment on what you like most about this video, and you can also share in your networks or like the video. See you in our next class.